Ladies and gentlemen, my name is NGATTU Johnnie. I'm a medical lab scientist contesting to become the next UMLTA president. We've been discussing the 7 pillars in our manifesto. We've so far discussed 3 pillars and we are on pillar number 4. In pillar number 4, we are looking at process. Process focuses on how the laboratorians serve in different environments. In which environment do we operate in, and issues that arise as we do our work. It's very important that we understand the national policy documents. As lab professionals, we work under the Ministry of Health, but we also work at interministerial level. We have colleagues who are working with the Ministry of Water under different directorates. We have colleagues working under the Ministry of Agriculture. We have colleagues working in the education sector. We have colleagues working in the defense forces. But we all come together under our association UMLTA to serve together, to grow together, to improve the welfare of the lab professionals together. It's very key that we understand the policy documents, looking at, for example, the strategic plan of our association. Do we understand where we are going starting now? Do we understand the strategic plan of the Ministry of Health? How do we fit in? The strategic plan of CPHL as one of the key stakeholders we work with, how do we fit in? The medical lab professionals are registered under the Allied Health Professionals Council, under the Allied Health Act. Do we know this act? Do we know how to benefit from this act? There is a plan to merge these councils. Where do we fall? Ladies and gentlemen, it's very important that we understand where we need to be so that we are able to reach there together. We know that after each one of us as individuals, we have come together through UMLTA as the association. But after UMLTA, we have the Medical Lab Board. How are we engaging to work with the Medical Lab Board as an association? Beyond the board, we work with the Allied Health Council. How do we get to benefit from the annual subscriptions that we pay, from the annual licenses that we pay, from the registration that we pay? Ladies and gentlemen, it is important that we see how to engage. Look at the scheme of service. I want to thank our colleagues who have been working on the scheme of service that is being implemented stepwise. I know there are organizations which have adopted it. I also know that there are those working on adopting it. This goes hand in hand with the scope of work for the different cadres at the level of certificate, of diploma, of bachelor's, master's and PhDs. We are all together in this. Let us look at the lab structure. I know currently there is a discussion between the association, CPHL, the Ministry of Health, the Ministry of Public Service, the Ministry of Finance, on how to improve the structure of the lab professionals by increasing the numbers and specializations at different levels that we serve. We can continue to grow this discussion, ladies and gentlemen, at the association level and push for what we want. When you look at the Vision 2040, there is a lot that is inside it that talks about healthcare. When you look at Article 5.2, which talks about health, the lab professionals are covered in there. When you look broadly at the East African community, there is already a lot of engagement ongoing on how to remove the non-tariff barriers in issues to do with trade, in issues to do with the common market. How do we as the medical lab professionals fit within such agenda? When you look at the African Union, Agenda 2063, priority number 2 talks about health. This is where, as the lab professionals, We need to engage the African Union. We need to engage the Africa CDC. We need to engage the Islam and see how we fit within the broader Africa agenda. The UN Agenda 2030, the Sustainable Development Goals, goal number 3, talks about health, talks about the targets therein. How are we as the lab professionals engaging through the association to make sure that we are able to be part of growth by engaging in such initiatives? Look at the specializations we have. A quick count shows that we are about 30,000 when you do a quick count in terms of how we have come, where we've reached, and where we are going. Mind you, UMLTA is over 52 years old. That means that we have so many people who have done medical lab training and are actually practicing. There are actually families where the grandfather studied lab, the father studied lab, and the sons and daughters have studied lab and are actually practicing lab. How do we get to know the specializations within the medical lab industry? For example, in microbiology, there are those sub-specializations. Look at bacteriology, mycology, mycobacteriology. Look at virology. There is a lot of work that impacts on the healthcare system under microbiology. Look at clinical chemistry, hematology, blood transfusion and blood banking. When you talk about the specialties, you cannot forget to talk about histopathology and the subspecialties therein, like cytogenetics, cytopathology, histotechnology, histology, to mention but a few. All these are very important. Talk about parasitology and entomology, the vector control division. Talk about physiology, biochemistry. There is a lot of work ongoing to do with molecular biology and immunology. We have many colleagues who have specialized in public health, epidemiology, statistics, and biostatistics. We already talked about colleagues who are working in forensic science and toxicology, crime investigations, and the like. You know, Uganda is launching the first satellite on the 28th of this month. We need to have satellites in space. This gives us an opportunity to think about aviation medicine. What is our role as lab professionals as we discuss aviation medicine, space science, and technology? Issues to do with quality management. ISO 15189. Talk about lab logistics. The Maputo Declaration. Talk about lab management and general lab operations. All these are opportunities for us to understand the different specializations. I know that we can also have sub-associations under these areas where we can say UMLTA is the mother association, but we have specialty associations under all these areas that we can look at. When we continue looking at the general global picture, we know that there are opportunities under One Health, biosafety, biosecurity, issues to do with bioterrorism, issues to do with IPC, AMR. There is a lot of funding currently in AMR. When you look at the UN pipeline, you will know that the next big thing is cancer diagnosis. How do we get to work with the Ministry of Health, CDC, ASLAM, the Africa CDC, the International Union of Lung and TB Diseases, PEPFAR, UNAIDS, and all these other mother funding institutions? How do we engage them as an association to get opportunities for the members, for the lab association? Look at the campaign to have accreditation of the laboratories. I want to thank the team at CPHL and the different donor agencies who are supporting the lab accreditation under CAP or ASP or SANAS. All this is very possible because of the work of the medical lab cadres at all levels. Ladies and gentlemen, we need to think about having a national independent lab accreditation body. It is something we need to discuss and see how we achieve that. Talk about the the certifications. We need to be able to compete in the global market. How do we get to become members of the American Society for Microbiology, ASM, or the American Society for Clinical Pathology? They have these international accreditations, these international certifications. The Institute of Biomedical Science in the UK gives opportunities for laboratorians who want to become their members, who want to become their fellows. You can be in Uganda here, but accredited to work in the UK, which even gives you an opportunity to even be employable in the European Union. Talk about the governance structure, the framework under which we serve as UMLTA, the association, as the medical laboratory board, as allied health, our engagement with CPHL, our engagement with the Mother Ministry of Health, and other interministerial roundtable discussions. It is also important for us to understand the feedback we get as we go about offering our services. This is called the UXD, the user experience design. How do we get to listen to the feedback given by our colleagues, whether they are support staff, administrative staff, colleague health workers, or our colleagues as medical lab professionals? It is very important, and I want to invite you that we continue this engagement together as a Uganda Medical Lab Technology, most importantly as I serve you as the next UMLTA president. We can go to the next pillar, which is pillar number 5.